Ambulances sit empty across British Columbia as the union and the province clash over a new overtime policy which is negatively impacting caller wait times. Ambulance Paramedics of British Columbia, the union representing around 6,000 dispatchers and paramedics across the province, is reporting a significant number of ambulances sitting empty due to a lack of overtime approvals. The union released a PSA warning provincial residents about the negative impacts of a new overtime ban instituted by British Columbia Emergency Health Services on January 1st. The ban was to cut costs to adjust to a significant budget deficit, which has also led to cuts to ambulances and negatively impacted response times. The union explained that BCEHS has ongoing struggles with staffing levels, with approximately 25% of ambulances unstaffed on a daily basis. The president of Ambulance Paramedics of BC stated the PSA was issued as a warning to the public that if they call 911, they will be waiting possibly a long time if the call is not critical. In an interview with energeticcity.ca, APBC Communications Director Ian Tate stated that workers are willing to take on overtime, but the policy changes have altered the procedure. Now, instead of getting advance notice on which shifts are overtime and allowing workers to pick up shifts, workers are receiving calls on the day of shifts and having to make decisions on the fly. Tate explained that the new policy is disproportionately impacting rural and remote communities in the interior and the north of BC, where staffing was critically low even before the policy change and ambulances sat empty without staff. Tate recommends that patients seeking ambulance aid call immediately and relay as much information as possible to the dispatcher. High acuity calls, categorized as such due to the life-threatening nature of the patient's situation or injury, have faster response times during this time than low acuity calls. Read more at energeticcity.ca.